Australia and New Zealand intern pharmacist exams. Your abroad gateway. You have cleared your OPRA, but here is what most overseas graduates don't realize. OPRA is just the entry point. What comes next? The intern pharmacist journey determines whether you actually practice pharmacy in Australia or New Zealand. Today we walk you through exactly what awaits you step by step factually. Australia intern pharmacist journey. In Australia, passing OPRA makes you eligible for provisional registration with APHRA, the Australian Health Practitioners Regulation Agency. You then complete a supervised internship, approximately 1,575 hours, under a board-approved preceptor, a fully registered pharmacist responsible for your clinical development. Once you completed at least 75% of those hours, roughly 1,180 hours, you became eligible to sit the intern written exam, 75 multiple choice questions, 2 hours of time, administered by Australian Pharmacy Council. The oral exam, where the many international candidates struggle most, not from the lack of knowledge but from the lack of preparation of clinical performance under observation. New Zealand intern pharmacist journey. New Zealand pharmacists follow a different structure for overseas graduates. After OPRA, you must complete the New Zealand Pharmacy Legislation course, the NZPL, before you can proceed. This is a mandatory and non-negotiable. You then register as an intern pharmacist with the Pharmacy Council of New Zealand and join the Evolve Intern Training Program run by the Pharmaceutical Society of New Zealand. The final gateway to full registration is the Assessment Centre OSCE, a series of observed clinical stations covering patient counselling, prescription review, drug interaction and professional communication. This is where international graduates are most vulnerable. The OSCE tests real-time clinical reasoning and communication, skills that require structured preparation, not just clinical hours. Pathways are structured, assessed and demanding. International graduates who arrive underprepared often add 6 to 12 months to their timelines simply because they did not know what was coming. The competency expectation and the documentation standards, the clinical communication norms of the Australian and New Zealand healthcare. These are things you prepare for before you arrive. At Elite Expertise, we prepare overseas pharmacy graduates, especially for the intern pharmacist phase in both countries. Preparation covers the intern written exam and the intern oral exam for Australia and the Assessment Centre OSCE for the New Zealand. The clinical communication skills that both systems demand. Our candidates arrive ready and the results speak. Pharmacists trained with us are working in hospitals, community pharmacies across both countries, having cleared their intern assessment centre on the first attempt. If you have cleared OPRA or planning for the internship, comment the word intern below. Our team will reach you out, assess your stage and give you a clear roadmap for what comes next. If you find this video useful, like this video and subscribe our channel for more content like this. Thank you so much.